Happy Sunday to you. This is Gina with Stars Touch Heartfelt Healing. I'm coming at you with a subject that I'm extremely passionate about, and that's Lyme disease. I've had Lyme disease since 2009, and I have multiple co-infections, Bartonella, Babesiosis, Mycoplasma. All of these were in one tiny deer tick bite. And the reason that I'm having this video out right now is because of the fact that the ticks are out and about big time right now due to the cool, moist weather. I had a close family friend give me a call a couple days ago, and she had 2 tick bites all at the same time, one on her tailbone, one on her hip. She ended up going into the doctor, and the doctor was able to remove the ticks and also give her some doxycycline, and that's good. It's important to do something immediately if you have a bite. I had a bite about a month ago, and I wasn't sure if it was a bee or a tick, so I went in and immediately had it checked, and so the doctor wasn't sure, so there was no medication given. What I do is I automatically start doing something. Now, before I explain what I do, I'm just going to say I'm not a doctor, I'm not a naturopath, and it's important for anybody that's watching this to either talk to a medical professional or a naturopath. Also, do your research. Go online, look it up, see what is in these different remedies that I'm going to mention. But it's important for you to do something. If you get a tick bite, waiting and seeing is not a good approach. When I was bit in 2009, it took 10 days before I got the bullseye. I had a bullseye that showed up on my rib cage about the size of a grapefruit or larger. But in 10 days, it was too late. I started treating with doxycycline 10 days later, and yes, it did take away my bullseye. I took it for 2 weeks. That's what I was given. But that wasn't enough. And what happened is that because I had so many different co-infections in that one tick also, I have been dealing with this for over 11 years. There is a way to live with this illness, though, with joy and to get better. And there's a lot of things you can do. And I'm going to explain all those things just so that everyone has an idea of what I did, in case it can help you too. I'll make multiple videos on different things to do with symptoms and different things that I did to combat certain issues that popped up along the way. But right now, my concern is just to tell you what to do if you get a tick bite. So if you get a fresh tick bite, definitely go to your doctor. Your doctor hopefully will give you some doxycycline, which absolutely can help kill the Lyme spirochete. The importance of getting it into your body as fast as possible to get it to kill it before it gets out of your bloodstream is very important. Time is of the essence. The other thing is that the lady that got bit by the 2 ticks just a couple days ago, she also had 2 tick bites 2 years ago. And when she came to me and told me this, I explained to her that I thought she should do something more than just what the doctor gave her. She should talk to her naturopath, find out if they can give her some Andrographis. Andrographis is something that can kill viral infection. It can kill bacterial. It's a Chinese herb, and there's another name for it. It's Zenliam. And it's just a powder form or a capsule. So this Andrographis is something that it's just invaluable. It's something that can definitely kill different things. And so what she did is she took the Andrographis. She took, I think it was like 1/8 of a teaspoon of tea a couple times a day in some warm water. And she was fine this last 2 years. She never ended up with the symptoms. She did great for these last 2 years after having those bites back then. So now she immediately, of course, is trying the Andrographis again along with her doxycycline. That's an option. It's something that, again, talk to your doctor or naturopath about it. Just make sure that it's something that goes with any kind of meds you may be on. I don't believe she takes any prescription drugs, so that's what she's done. And that's what she's doing now. The other thing you can do is brew a container of chaga. You can put a chunk of chaga in the crock pot the chaga looks like this. It's hard as a rock. It's a mushroom that grows on a birch tree, and I'm going to actually do a video and take people out to show you just how to harvest this stuff in case you are in an area where you can get your own. Otherwise, they do have it at the health food store, so it's an option also. Now, how much you take of this stuff, it always is going to depend on each person. For me, I always take a lot less first to try, and then take more if I feel like I can tolerate it in order to combat anything that's going on. Chaga can be really great just to drink too, with all the vitamins and minerals it has in it. So it can be beneficial to you even if you haven't had a tick bite. So what I'm going to do is explain to you the way I judge whether or not my remedies that I'm taking works. As far as getting a test for Lyme disease, it's very difficult to get a good test. When they take the test, it's going to depend on what's going on in your body at the time on whether or not it's going to show up accurately. You could get a test back that says it's negative when it's actually positive. It's happened many times for many people. I've been to all the Lyme meetings over the years at White Bear. I've been to the conference in 2013, the ILADS conference with all the doctors from all over the country. I've been to the Capitol when we were fighting down there back in 2010 to have the doctors be able to treat as they see fit. This is a very difficult illness, and people have been fighting for years to make sure that we are getting the best treatment we can for this disease. But with that in mind, what I've come up with is that if you, in the morning, take your temperature, get you a Vicks thermometer. It's about $10. You can get them just about anywhere. It's flexible and it reads quickly. Take your temperature when you wake up. If your temperature is under 98.6, under normal, mine runs anywhere from 96 to 97 in the morning. If your temp is low, a lot of times that can mean that a bacteria has dialed down your hypothalamus, somehow gotten into your system and tried to make your body colder. That's how the spirochetes actually multiply. So it's important for you to realize that if your temperature is low and then all of a sudden you make a batch of this chaga and drink it, you drink maybe, so I drink a quarter cup a day just for prevention. I drink it all the time because I like it. It tastes good, and it also has a lot of antiviral, antimicrobial type factors. So if you have some of this chaga and all of a sudden your temperature goes up an hour or two later, it's kind of an idea of realizing that it must be killing something. That's how I judged my illness this whole time, whether it be with the Bartonella, taking a treatment for Bartonella, checking my temperature, taking treatment for Babesiosis, checking my temperature to see whether or not my body's fighting that at that particular time. And it's unfortunate that the testing is so difficult, just getting a typical test at the doctor. But a lot of times, like I say, depending on what these bacteria are doing, it may not show up positive, even if it is. So it's important to know these things just in case it helps you in any way. I also take olive leaf extract every day. It might not be something that'll work for you. And like I say, double check with your doctor or naturopath. But olive leaf extract can kill viral. It can kill a lot of different things. And it also has a lot of immune boosting benefits. Same with chaga. So what I'm going to do is at the bottom of this video, I'm just going to write down these different things so that you can actually look it up, study up, and get an idea of what you can do in order to have this at your fingertips in case you have a bite. And then, of course, ask your naturopath, ask your doctor if this is something that'll mix with what you're doing. But never wait and see. By the time you've got a symptom, it means that this stuff is already invading in, and it's trying to take over one part or another, and it's just not worth waiting for. It's just not worth waiting. It's important to do something right away. And so I hope that this wasn't too confusing. It is a very complicated issue, and I'll be making a lot more videos, and I am working on that book to get it out as fast as I can. But if you get a tick bite, please go into the doctor right away, and please consider some of these ideas in case it's something that will stop you from getting what I've been dealing with for almost 12 years now. And I hope you have a happy Sunday. I know this isn't a fun subject, but please, prevention is one of the biggest things too. Make sure if you're out in the woods, if you're going to be out there, take that shower, check your body, pay attention to how you feel, making sure that you know whether or not you feel normal. If you don't feel right sometimes, if something comes up where you just know something's not right, you might have a bite and not have seen it. It could be on the top of your head. It could be somewhere where you don't even notice it. And there's only 60%, I believe, on the bullseyes. Not everybody gets a bullseye. And don't quote me on that, but it's definitely not all the time. You may get bit and you may not have a rash at all. And so that's very important. But I'm going to stop this video right now, and I'm going to just say a prayer for everyone. I'm praying for everybody to have good health and to not have to deal with this at all. I'm praying for everyone to not have to deal with this at all. Thank you so much for watching.